Nanothermia is the ultimate step in the application of high temperature fields in pathological areas of the body, selectively choosing the area where the tumor or where the pathology actually lives. When we tackle a certain pathologies, mainly cancer these days, because it is one of the most frequent pathologies we encounter in our daily practice, we need to select the area of the pathology in order to obtain the best outcome. Nanothermia is able to identify particular cell frequencies, mainly from the cell membrane, which has a different frequency of action compared with normal cell populations. When this frequency is identified, selectively the radio frequency of the nanothermia is able to induce apoptosis in the cellular population. That is a translation of cellular death. When we create death around the tumor area, a natural bag of detritus, a residuum, will be created, and then the normal mechanisms of the body will be able to brush out those areas of necrosis and apoptosis. In summary, nanothermia is the laser of the hyperthermia techniques with a long time experience since the early 1950s. There are three main fields where nanothermia is currently indicated in daily practice. Unfortunately, oncology pathologies are the most commonly seen in our outpatients department. For the last 25 years, nanothermia has grown successful cases treated from every oncological field available at the moment. Mainly what we do is to create a feeling of success by working in short periods of time. When an oncological patient approaches our clinic demanding results, we basically propose a 4 to 6 weeks therapy pattern where we will be able to see results based on radiological examination. When we treat an oncological patient, our main goal is to stop the natural progression of the cancer and, in the best scenario, to eliminate the tumor mass. This is proven thanks to periodic evaluation with either a CT scan or MRI scanners. The second main field of nanothermia practice is the musculoskeletal pathologies. High yield sport people, stressful occupations demanding a considerable physical effort will benefit from nanothermia by restoring fibers, patterns and muscular areas of damage being reduced to healthy tissue in a very short period of time. Fibromyalgia is one of the most successful fields where nanothermia has the latest advances in terms of successful treatments and outcomes in a very short period of time. Nanothermia has been on the market for the last 25 years, despite the fact that hyperthermia or hypercaloric fields have been applied for more than 50 years. The experience, when we talk about experience, we need to see two main fields, the global experience and the local experience. Around the world, we have more than 150,000 patients treated every year with a rate of success close to 85%. These data are obtained from first impact journals of scientific nature. We do not consider, in terms of that data extraction, anything like a second degree journals of impact, and we base our results in prime line scientific journals around the world. In terms of local experience, we work with all kinds of oncological pathologies. Although we do treat digestive, colorectal, hepatobiliary pathologies, neurosurgical pathologies, every patient will be studied and assessed accordingly in order to find the most convenient way to treat them. We will always propose a plan of action. I don't like the term alternative medicine. I prefer the term complementary medicine because nanothermia is synergistic with current trends in neuro-oncology or digestive oncology and in general any oncological treatment. We do work together with chemo and radiotherapy, although nanothermia is able to be as effective on its own. During the last 5 years, we have seen incredible success in patients treated in this center. Cellumed clinic is treating currently all kinds of oncological pathologies. In the last 2 years, we have seen regression and disappearance of gynecological cancer, metastases in liver and lungs, hepatobiliary cancer, including pancreatic cancer, and a dramatic reduction on the size of rapidly progressing brainstem gliomas, among other pathologies. Cellumed Clinic in Marbella works with a very particular approach. We believe in holistic approach to patients. A patient is not a pathology, a patient is a person with a huge amount of personal circumstances, including social, affection, sport life, pattern of sleep, etc. So we will study every patient individually and try to personalize to a maximum any therapy we offer here. Every patient with an oncological pathology will have a detox program associated to its treatment, as well as a particular dietitian following his progress or her progress through the whole treatment. To start with, we propose a alkalinization of the bloodstream by lowering or lowering the pH, as well as a particular diet pattern to promote elimination of toxins. Equally, before and after every session of nanothermia, we promote the use of oxygenation and ozone therapy in every patient. Finally, we will use magnetic fields and high magnetic fields to increase the effectiveness of a nanothermia applied to certain types of cancer.